What is KPV? Well, if you've ever noticed that your gut is irritated, your skin flares up, or especially for women, when your hormones shift, you suddenly feel like you react to things, that's not a coincidence. That's about your barrier biology, your gut barrier. So today we're going to talk about KPV. This is one of the smallest peptides studied for inflammation, but it's also really interesting when it comes to gut health, skin health, immune balance, and also peptide tolerance, like tolerating other peptides, and in particular for women over 40 because of the estrogen component, which we're going to get into. KPV stands for lysine, proline, valine. That's just 3 amino acids. It's tiny, and it's actually a fragment of the alpha-MSH. That is a melanocortin hormone, and your body makes this already to regulate inflammation, immune signaling, and tissue repair. So I like to think of KPV as the calming fragment. It's a little fragment of that alpha-MSH. Now, alpha-MSH does a lot. It affects pigmentation, hormone signaling, appetite, immune effects, but KPV strips all that away. It only has one job, and that job is to turn down inflammation and help our gut barrier tissues to heal. It doesn't have the tanning effects like melanotan 1 or melanotan 2 because they also use alpha-MSH receptors, and it doesn't have any hormone activation like melanotan 2. So it just focuses on repair. And we're going to dive into all of that. So before we get started, let me give you a little context of where I'm personally coming from. I'm not a medical doctor. I don't diagnose or treat disease. I'm a PhD trained scientist, and I have spent over 25 years studying molecular biology, specifically cancer biology, but cell signaling, molecular pathways, and I currently work in cancer detection and precision medicine. So my training is just around reading and interpreting the primary scientific literature and animal models, mechanistic studies, translational data. That's exactly how I approach peptides and longevity topics, which I'm obsessed with. So kind of applying my background to what I'm really interested in, which is longevity and peptides. So there's a lot of noise in this space and a lot of oversimplification and a lot of like one mechanism equals outcome thinking. So I just like to kind of break down biology from a broader standpoint, if you will. So when I talk about peptides like KPV, I'm not making any claims. I'm just explaining mechanisms and what the research shows, where the gaps are, and how these tools could fit into a bigger picture and how you might apply them in your own research or, specifically for inflammation, gut health, hormones, aging in regards to KPV. So point I'm trying to make, this is education and science first, and it's meant to help you understand your body better, not to replace medical care. All right, let's talk about KPV. Your gut lining and your skin are not passive tissues. They are very active immune organs, which makes a lot of sense. They're protecting us. They're constantly deciding what gets in, what stays out, and also when to trigger an inflammatory response, which is your body's way of fighting something that shouldn't be there, right? So about 70% of your immune system lives in the gut. And I like to think of this as our TSA at the airport because we put our immune cells where most of the passengers are coming in and out, and it makes perfect sense. So we want to make sure that we're monitoring what's coming in, what's coming out, and whether or not we need to respond to that. When those barriers break down, meaning the gut, that's when our immune system can get extra noisy and we can start to see that as inflammation. We can see, that becomes leaky gut, histamine reactions, mast cell flares, eczema, rosacea, and even rashes. And then even that feeling of like, all of a sudden I just react to everything or everything's bothering me. And this actually becomes pretty common in perimenopause because estrogen is actually helping to maintain some of that barrier integrity in the gut. And estrogen influences our mast cells. So those are the cells, by the way, that release histamine. And estrogen can also increase histamine. So when estrogen starts to drop, we can see that like the tight junctions in the gut can weaken, and that's going to increase this gut permeability, and that's going to increase this mast cell reactivity, and then our again because of estrogen, that histamine clearance can start to slow down. So that's why we start to see all these gut and skin issues in midlife. And it's also another plug for why estrogen replacement is so important as we age. Our estrogen cells are all over in the body, not just the ovaries, but also obviously in the gut, in the brain, in the every cell in the body, essentially. Now, KPV does not block our immune system. I like to think that it re-educates it. That's kind of how I frame it. So we're going to dive into what the research shows around KPV. First up, it suppresses inflammatory cytokines. So it lowers things like TNF alpha, IL-1 beta, IL-6. These are the same signals that drive inflammatory bowel disease, eczema and psoriasis, and even chronic low-grade inflammation or inflammaging. It also interrupts NF-kappa B. So NF-kappa B is like our master inflammatory switch, and once it's turned on, this inflammation can become self-perpetuating. And there's multiple studies showing that KPV actually prevents NF-kappa B from translocating into the nucleus, meaning that that inflammatory cascade is not going to fully launch, and we are going to have a much better or lower reactivity, I should say. And this is huge for chronic conditions where inflammation never fully resolves. It can be super helpful for anyone experiencing some of these chronic inflammation issues, or we'll get into other applications as well. I'm going to talk about oral peptides because there's a lot of confusion around this, and we have a lot of information on KPV. So oral KPV is actually biologically plausible. And I think this is one of the most misunderstood things or important parts about KPV. I always get people when I recommend it, like, Winnie, I want to inject it. And it's like, well, okay, you can, and that's fine. But KPV, there's actually a dedicated transporter in our gut called PepT1, and its job is to absorb small peptides, not amino acids, just these smaller type of peptides. So KPV is exactly the kind of peptide that PepT1 recognizes and lets into these epithelial cells, which are the gut lining cells. We have this gastroenterology paper that shows that KPV was actively transported into the intestinal epithelial cells via PepT1. And once inside the cell, it suppressed the inflammatory signal, and it actually occurred without having to bind to any receptor. So KPV does not need to be injected in order to work, at least in the gut. So that's a strong, for people that don't want to do injections, I think that's a really great option. And if you're trying to heal the gut, like, why not get it right to the site where it's needed and it's actually entering those specific cells, the epithelial cells. So I am a huge fan of it, and I have used it and I like it. So, and I'm also a fan of the injection. So both are fine. I just wanted to make that clear that it does have a specific receptor to translocate into the gut cells. Now, it also acts that's the local environment where the inflammation is, and we know that a lot of the immune signaling is happening in the gut, so it just makes a lot of sense. And that's why the oral or colon targeted KPV has a lot of benefit in the animal models, and the animal models were in ulcerative colitis. So what was shown was they were actually able to restore the gut lining integrity, reduce inflammation, and this was actually when other treatments had even failed. So KPV is that powerful. This is not speculative. This is well described in the literature. There are tons of papers, of course, in animal models, but it works really, really well. Another major advance came when researchers paired KPV with hyaluronic acid in this paper here. So hyaluronic acid does a couple of things. It improves mucosal adhesion, and it also protects peptides from degradation. So in the ulcerative colitis models, the hyaluronic acid, it was like a functionalized KPV nanoparticle, which sounds really cool. And what this did was it improved localization to the inflamed tissue, it enhanced anti-inflammatory effects, and it improved barrier healing. This is why you'll now see KPV included with a lot of these advanced gut formulas rather than, you can do it standalone as well, but a lot of formulas have BPC 157, TB 500, GHK copper, and KPV all combined, lorazepatide, because all those things are very, very impactful for healing the gut. I'm talking about these oral formulas. Yeah, or KPV by itself. I love this one because it does have the hyaluronic acid included. So I think that Level Up does an excellent job of formulating all of their oral peptides. So that's my preferred vendor for oral options, as you'll know if you work with me, because I'm always recommending them. And it's not necessarily about stronger peptides, it's just a smarter delivery system. So again, nothing wrong with injectables. I think obviously I'm a huge fan of that. They work really well. So this is just an alternative, and it works really well as well because, you know, we have that evidence. Okay, let's talk about mast cells, because this really matters if you're someone who's ever reacted to peptides, and I think it's far more common than it really is out there. I've been hearing more and more about it lately. As the more I talk about it, I feel like the more people are sharing that they have reactions as well. So what are mast cells? First of all, they're immune cells that live in the gut, the skin, the connective tissue, and around blood vessels and nerves. And they're filled with histamine, cytokines, and inflammatory mediators. So their whole job is just to protect you and to tell the body, like, hey, something's going on here. You need to pay attention to this. I'm releasing all this histamine over here. Come check it out. And so they can, though, become overactive and sort of feel like everything's a threat. You know, they're constantly throwing out histamine and the body's like confused, like what is going on, right? And why does that happen? A lot of times when our estrogen levels start to fluctuate, ladies, this can sensitize the mast cells. They can become very hyperreactive. And of course, our gut permeability changes. So again, remember the immune system is in the gut, a lot of the immune system. And so if that's reactive and we're having leaky gut and things are getting out into the bloodstream, it's just a vicious cycle. And a lot of it revolves, I don't like to blame estrogen. We love estrogen. It's just we really need her. And we're used to having her for our whole life. And then suddenly she's gone and it's like the body just literally falls apart. And so that's why I'm a huge advocate for appropriate use of menopause hormone therapy, or MHT. So now, when we talk about certain peptides that we have reactions to, those are going to be CJC1295 is probably like the top one there. I think a lot of people react to that. Sermorelin is also one, and other peptides like MOTS-c, tesamorelin maybe. These don't cause mast cell activation, but basically if your cells are already primed, then you have a lower threshold. And when you introduce these peptides, you can start to notice these symptoms. So you might get bumps, like itchy bumps, flushing, itching all over, redness, even anxiety, headaches. A lot of those symptoms are related to that histamine release. And there's certain things we can do to resolve that. One of those is KPV. So it's indirectly helpful because it's going to help reduce that cytokine signaling. It's going to help stabilize the barrier tissue, like the epithelial cells in the gut, and even improve that leaky gut situation. It calms NF-kappa B, and it can reduce that histamine-driven inflammation. So it's overall very protective, very supportive for this situation. Now, I think you should also, of course, support your estrogen levels and make sure that overall living in a low, like you don't want to be adding fuel to the fire. So of course, a lower inflammatory diet, taking your vitamin C, your quercetin, that can help with that as well. Supplementing estrogen if that's needed in certain contexts, but KPV can be another benefit on that, on top of that, as well as, I know this video isn't about, it's about KPV, but also low-dose naltrexone can also help with some of this inflammation and can really help to support these pathways. But we're not suppressing our mast cells. Like, you know that I always say this, if you watch my other videos, we definitely don't want to suppress our immune system. We need our immune system. We love our immune system. We just want it to be more regulated and more balanced. So we're not suppressing mast cells. We're just removing the reason that they're activated. And that's a critical distinction. So again, kind of we want to look at the systems biology. Where does estrogen fit in? Where does, KPV help support some of that? Our diet, our nutrition, all of these things kind of play a critical role and are very important to consider together in context. But this video is about KPV, so we're kind of zoning in on that aspect. Now let's talk a little bit about the alpha-MSH and melanocortins. These have been studied for decades as anti-inflammatory signals. Full-length melanocortins bind to multiple receptors. So we have MC1R, MC3R, MC4R, there's a whole bunch of them. I think there's 5 or 6, and they can affect pigmentation, they can affect appetite and hormone signaling. Now, KPV does not do that, but like I mentioned earlier, we have our melanotan 1 and melanotan 2. They also work through these melanocortin receptors, and they do have those functions. So KPV just retains the anti-inflammatory function without activating those other receptors. And that's why it's often well tolerated in sensitive individuals. And I'm going to talk about how I personally use it. So I really like using it when I've had gut issues. Like, when I first started, I'm 50 now. So when I first started perimenopause, like 10 years ago, I started having a lot of gut issues, and that's very normal because our gut microbiome actually starts to shift. And then estrogen, of course, as it's kind of leaving the building, we start to notice gut issues. And so I finally healed my gut with the addition of some peptides, and one of those was KPV. So that was super helpful in healing my gut. I used the Level Up, the Ultimate GI Repair, and I also used BPC and TB500 and KPV injections. So I did a multi-layer approach. Now, I also continue to use it because I am sensitive to I have a lot of this histamine reactivity, never had this my whole life. All of a sudden, I'm in that stage. So whenever I'm taking a break from growth hormone secretagogues, I will do a cycle of KPV to kind of reset some of that histamine reactivity that generally I try to avoid the CJC and the Sermorelin because I do react to them. So I just stick to ipamorelin and I don't have the reaction. But if I want to try some, if I notice that I'm getting sort of those reactions to peptides, then I will layer in KPV. That's basically what I'm trying to say. And like I said, I'm also in that hormone transition phase. I'm still cycling, but we're getting there. So I do use estrogen support because my estrogen levels have dropped. So I do use the patch. This is just the stage that I'm in. And I found that KPV is super, super helpful for supporting that system, supporting that inflammation and all of those things. And it does so a little bit differently. I know I've talked about how GLPs are helpful for supporting inflammation. I feel like KPV, though, hits a little bit differently. It hits a different pathway. So even though I do the microdosing of GLP, I feel like it's still helpful to rotate KPV. I probably do it like 3 times a year, probably about 4 weeks. Yeah. And if you want to know dosing, so most people do it well with 250 to 500 micrograms. And it doesn't matter when you do it, morning or night. Personally, when I first started using it, I felt like it made me a little tired. So I just put it before bed. And personally, I like to use any of my sort of healing peptides at night. I just feel like while the body's resting, you're getting all that healing happening. So personally, again, GHK copper, BPC, KPV, those I would put at night, growth hormone peptides as well. That's what works for me. There's not a right or wrong way of doing any of those or a right time. Now let's talk about inflammaging. And this is more of a long-term discussion, like a longevity-based discussion. So chronic inflammation is at the root of many of the chronic diseases that we have. So cardiovascular disease, metabolic dysfunction, neurodegenerative diseases, autoimmune diseases, and even our skin aging. So this is all that inflammaging. Inflammaging just means inflammation that happens as a result of aging. And I've done other videos where we kind of go deeper into that. I'm not going to do that here, but that's basically as we get older, a lot of things start to decline and, our inflammation starts to go up. And that's sort of the root cause of all of these most common diseases in humans. And so KPV, I wouldn't necessarily say it's a longevity peptide in like the flashy sense of like an epitalin or something like that. But I actually would. I would actually say it's lowering that baseline inflammation and it's repairing the barrier, which is super, super important for our immune system, our immune system to be regulated, for our inflammation state to be regulated. And we do know that's a driver of aging. So it's targeting one of the root causes of aging biology, one of the hallmarks of aging, right? So in a sense, I would say it's a longevity peptide. It's just not in the sort of sexy sense that you think of like other longevity components, I guess. It's just like it's just quietly doing its job. But it's it shows up in our gut protocols in actually skin repair formulas. I'm not actually sure why I haven't seen this yet. I think there are some publications on using it topically, but we don't really see it in commercially available, but it could be really beneficial for inflammatory conditions on the skin, like rosacea, and then also in these immune reset stacks. So that's where it's kind of the most useful and most important. It is, like I said, it's a quiet peptide. It's doing really important work, but it's not a peptide that you feel, at least not right away. You're going to feel it after time, and it shows up as like you're less sensitive, your skin is improved, you feel less inflammation, you're digesting your food better. It's just subtle, but subtle more so than other peptides that you feel. But it's just subtly, quietly doing this important work of calming down the inflammatory cascades. And sometimes that's exactly what the system needs. So it can be super helpful. So KPV is not hype. It's not flashy. It's not for everything or everyone. But if the problem is inflammation or gut barrier breakdown or histamine reactivity, peptide sensitivity, then this is one of the most biologically sound tools we have. And it's backed by real mechanistic data, animal data, but I think the mechanistic data look really good. And the way that our immune systems work is very similar. Those mechanisms are very, very similar. But as always, this is educational, not medical advice. I'm just here to talk about the science. The science is very solid. I personally love this peptide, and I just wanted to kind of do a little bit of a deep dive on it. So sometimes, the smartest move is just calming the system down before we kind of go into some of these more stimulating peptides or these growth repair peptides. It may make sense to get the gut fix first and have that baseline before we move into stronger peptides like that, like the growth hormones. And if you found this useful, drop me a comment and subscribe, all the things. And I will put in the description more details and also where you can find me and where you can find the peptides that I personally use. And I also have a free peptide cheat sheet that you can download from the link in the description. And with that, I'll see you in the next video.